Hello and welcome to StormShannon.com. This is the first video to get you started on figuring out what is going on with your own system and treating yourself. In this video we're going to be covering what I call the four-way straight leg raise. With this you'll be able to assess what's going on, where the problem is, and what to treat, and be able to retest to see if you're making a difference. So this is the very first thing that I start with patients, and then we can move on to more complex things. The first part of this is going to be the prone straight leg raise. So for that particular one, we're going to have you lay face down, and you're raising your legs straight up as high as you can. Now when performing this, you want to make sure your head is facing down. For the purpose of this video, I'm going to look at the camera so you can hear me. So, because for the first part, we want to do it looking straight down. We're going to raise both sides. Now, the things we want to pay attention to, the most important is, do you have any pain? Whether it's in your hip, your low back, your middle back, anywhere, that there should not be any pain with this activity. So if you have pain, then what we're going to do is we're going to work on the leg of the side that you had pain. So for the purpose of this, we'll say that the right leg caused me some low back pain. So if that is the case, I'm going to come up and I'm first going to check for any tenderness through the groin area, all the way up through here. Usually the main spots you're going to find that are tender are down towards the knee and then high up on the inside. So first I'll start down here. If I find anything that's tender, I can massage that, or what I like to do is use a lacrosse ball, and that way I can get a little more pressure on it and I can work that. Now you want to work on releasing that knot for about 2 minutes. When you get done, you're going to recheck the prone straight leg raise. If it's better, you know that was a major spot of concern for you. If it's not, keep working your way up. If there's still a little bit of pain but it is better, also search for more knots and then retest again. Once you've cleared this, if there is still some pain remaining, we move on to the next primary spot, which is going to be in the outer part of the calf. So through that outer calf, if you feel through there and you find any tender spots, same thing. You can do some self-massage on it, or what's really good for this is using just a standard rolling pin, or you can buy one of the muscle rollers that they sell at the sporting goods stores. But you just want to get in there and roll those knots until, same thing. Spend a good couple of minutes on each one, work your way all the way up and down, and then recheck the straight leg raise. It should be improved. If you get to the point where it's 80 to 90% better, we can move on to the supine straight leg raise. If it's still bothering you though, the next part of this, and the reason I told you in the beginning to keep the head down, is if it's still bothering me, now I want to turn my head to the left and check, and to the right and check. If it changes with that, let's say when I look to the left, it makes it better. When I look to the right, it makes it worse. The side that makes it worse, or if one side makes it better and you can't tell on the other, the opposite side of the one that makes it better, is you're going to find knots through your neck. So we want to feel through there, starting right at the base of the skull, working your way down for any tender spots. Same as with the other areas. You're going to massage those knots for a couple of minutes and recheck. At that point, once you get it 80 to 90% improved, we're going to move on. So the second part of the straight leg raise series is the supine, or the face up straight leg raise. So just the reverse of what we were doing before. For this one, you also want to keep your head down, raise one leg, raise the other leg. Now, we're looking for the same kind of things. We're looking, the main one being pain. You know, you might also notice, you know, if you can lift one side a lot easier than the other, you know, then the side that's harder to lift, we need to work on that side. Same with the prone straight leg raise, the first one when you're face down. So for this one, let's pretend that, you know, I didn't have any pain, but it was much easier to raise my right leg than it was my left leg. So my left leg was restricted. In that case, what I want to do is I want to check on the, you know, if it was the left leg, I'm going to check the right side, right along the rib cage, and see if there's any tenderness in there. You know, or in some people, it's really, you know, it feels more like a numbness or almost like a ticklish feeling. If you feel like this, you know, it is tender at all, you can also compare it to the left side. But if it is, we want to check into the forearm. If you can't tell and you know that the left one was hard to raise, just check in the forearm anyway. So we're going to feel right around the elbow, just below, right in the meaty part of the forearm. We're going to look for any tender spots there. Once you find them, same thing. We're going to massage those spots for a couple of minutes, and then I'm going to check that straight leg raise face up or supine once again to see if I'm improving, if it's getting easier or there's less pain. Same thing, I'm looking for at least an 80% improvement before I move on to the final straight leg raise series. So we've done face down, we've done face up. The next part of this series is to do the sideline straight leg raise. So for this one, we're completely on the side. We want to make sure we're completely straight. We're not bent at an angle. Straight all the way through. Get that hip to where it's a little bit forward here. What I'm going to do at the top leg is I'm going to push it back a little bit and raise it up. Once again, preferably I want to do this from this position. You don't have to relax your head, at least keep it in line. For the purpose of the video, I'm going to do it on my elbow here. So with this one, we're looking for the same stuff. Is there pain? You know, for this one, you should feel a little bit of tension, like right in the outside part of the hip, because that's the muscle that's working. But do you feel pain anywhere else? Does it cause low back pain? You know, does it cause middle back pain, upper back pain? You know, is it just really hard to lift? Or one of the big things that we'll see is if there's a lot of weakness in the side of this hip, when you go to extend and raise that leg, what happens is you can't keep this straight and your hip drops back. You know, that's a good indicator too that we have some problems going on through here. If we have any of those conditions, then we need to work our way up the same side arm. We're going to find some issues there. So, you know, if my left side was weak or caused pain, then what I want to check first, if I haven't already released it, is the forearm once again on the same side. You know, so before I worked the right one, so maybe I didn't do the left one yet, and I found weakness in this left side, so now I need to check the left one, and I need to release that. Once again, I can check and see if there's any tenderness here, which is another indicator that this needs to be released. So I can release the forearm, I can recheck, this should be better, and I can recheck that straight leg raise, and it should be getting better. If it's still hard to do, or that doesn't correct it, or you've already released the forearm before, then what we want to move on to is releasing the deltoid. So the deltoid comes around and attaches right at the base of the rounded part of the shoulder. And right in there, a lot of times you'll find, you know, basically like a ropey feeling type of muscle. You know, and that's that tendon of that deltoid. So we can feel in there, see if there's any tenderness. This one isn't always that noticeable, but what you can do to really check is to use a lacrosse ball, either up against the wall or on the floor, and get right into that spot, put pressure on it, and start working back and forth a little bit to break that up. Once again, spend a couple of minutes on it, and then recheck the sideline straight leg raise. This series of the straight leg raises is something you can go through anytime throughout the day. I want to make a note that with all of them, we talked about it with the face down, if there's still a little bit going on after you release stuff, check turning the head, see if it makes a difference. You can do that with all 4 of them. So, with the face up, face down, left sideline, right sideline, if you find that you're releasing the muscles just doesn't seem to get it all the way, try turning your head different directions and see if it changes. If it does, we need to come up, release the neck, and recheck. Do this, try to do it as often as you can, keep resetting it, and this will help tremendously. Once you get into a good pattern of being able to release this, we can back this up with exercises specifically designed to strengthen up the muscles that are being weakened from these other muscles being so tight. So that will be in the next video, the exercises combined with the straight leg raise. So look for that video, probably right below this one, and start working on yourself to correct your own problems. That's it for this video.